MDMA, super fun party drug, now therapy tool for PTSD. If you followed this channel or my podcast for any length of time, you'll have heard me talk about psychedelics and their potential as really adjuncts for therapy. So things that can enhance the effects of therapy. And MDMA looks like it's going to be the first one that gets official approval from the FDA in the US. And that means that doctors are going to be able to prescribe it. And along with that comes the possibility that MDMA could even be used off-label, which basically just means it's not being used for the exact thing that it's been approved for, but doctors can make a judgment call and prescribe it in what we call an off-label way. So this brings about a lot of questions as to, well, how does MDMA work in therapy, and what should we be reasonably prescribing it for if we are going to open it up to this off-label characterization? And the answer is really that we don't really know how any of these psychedelics, let's say, quote unquote, work when it comes to how they have their therapeutic benefits. Very broadly, what we see is that in trials, patients that undergo talk therapy, normal therapy, usually it's of the cognitive behavioral type, and then they have a session of MDMA, sometimes psilocybin, and then they undergo more therapy. The long-lasting effects of that therapy are greater than if they had just done therapy alone. So people report less distressful symptoms for a longer period of time than with just therapy alone. But nobody really knows why that is. And it's really, really hard to tease these things out. Again, if you've listened to some of the previous podcasts I've done on this, you'll know that the human mind is very subjective, and there's a lot of subjectivity that goes into a psychedelic experience, things we call set and setting, right? Like these drugs will impact people in a very different way. So we can understand a little bit about what's going on in the brain, the chemicals that are being released or inhibited, these kind of things, but we don't really understand why that leads to behaviors or feelings or emotions. And with MDMA, there's a theory that it is what we call an empathogen, meaning it enhances empathy. And there's been some rodent studies that look at this question, and there's been some human studies that look at this question. And in the human studies, it's really difficult to kind of tease out. There's conflicting results. And it's possible that, again, it's just going from a sort of mechanistic view of what's happening in the brain to outcomes like emotions and empathy is very difficult to sort of follow in an experimental way in humans. And it's also possible that just our experimental setups just aren't that good for teasing these things out. And this is why people turn to animal models. So like I said, some rodent models. And there was a really, really interesting paper out that has done some really cool work to show that, yeah, it looks like MDMA might actually enhance empathy in mice. And this is, one of the theories as to why it might work as a therapeutic when it comes to enhancing therapy. There's more of an empathetic connection with the patient to the therapist, or just to their surroundings. Are more open to empathy, and this might, increase the value of the therapy that they're receiving. But again, we can't really prove so far that the MDMA actually enhances empathy in humans, so we turn to mice. So with any work where you're using a model system, whether it's like a mouse model or even some plant models and stuff, the benefits of this is that you can strip away a lot of confounding factors. That's the goal, is that we're trying to get down to one or two questions that we can control all the other variables and just look at what happens when we manipulate these one or two things. So they're never perfect proxies for what's going on in humans, but they offer some very interesting insights. And in this case, we're looking at empathy-like behaviors, and specifically a paradigm of experiments where we look at the social transfer of some kind of what we would call like an emotion or a feeling. In this case, pain. So this has been well established in a lot of previous studies that if you have two animals, two rodents, let's say, two mice, one of them experiences some kind of pain while the other one does not, but yet they're interacting together for a given period of time. The one that doesn't actually experience the pain doesn't actually get in the case of the experiment we're going to talk about today, it was a small injection to create inflammation and some pain and soreness in one of the paws. The animal that doesn't actually receive that stimulus will behave as though it did. So it will kind of mimic these behaviors of its friend, of its partner that's actually experiencing this negative emotion. And you can do it with a positive emotion as well. And it's called this emotional transfer or social transfer of emotion. These are the kind of terms that get thrown around in the papers. And it's meant to be like a proxy for empathy. If an animal can understand that the other animal is feeling this way, and then it sort of mimics it, it sort of behaves in a similar way, then we use that as a proxy for, yes, there's some kind of empathy going down. So again, not perfect, but it's a really well-established experimental setup that you can do, and then you can test all of these different things to see whether that effect of the social transfer of the emotion is increased or decreased. And in this case, they did it with MDMA. And lo and behold, yes, MDMA seemed to increase the amount of time and the strength of the sort of transfer of the emotion. So you have two animals put together. One receives the inflammatory injection into, I don't know exactly which paw, but let's say, back left. The other animal then interacts with that animal for, I think it was 10 minutes. And then you separate them, and with a small brush, check the sensitivity of that back left paw that had received the injection, and then the same on the animal that didn't receive the injection. And the animal that didn't receive the injection will kind of show sensitivity as though it had been experiencing pain in that paw. And when an animal is on MDMA and then interacts with a partner who has had the injection, that sensitivity will be pretty pronounced and last for about 24 hours, which is more than it would if it hadn't gotten the MDMA. So that's a really interesting finding right there. And it shows that, yes, MDMA enhances this empathy-like behavior, this social transfer of pain. They had another setup where they did the same thing, but then they give the animal an analgesic, so something to remove the pain during the interaction. And you see that, again, this positive, we'll say, feeling of having the pain removed, the animals will again mimic that. So that positive feeling gets transferred as well, although not as long, it's not as strong as the negative emotion, pain. But it looks like MDMA is, yes, it's enhancing empathy or empathy-like behaviors in these mice. So then they wanted to go a couple steps further and isolate where in the brain this might be going on. And there's been a lot of other studies that show where MDMA sort of localizes in the brain, where it does a lot of its effects. And that's in a place called the nucleus accumbens. So rather than give the mice the MDMA just as an injection into the whole system, they injected it directly into that area of the brain and found, again, the effects persist. So it's a good indication that this is the brain region where the mechanism is at play, where things are happening that's leading to this increase in empathy. And they followed this up with a really, really neat experiment using a model of mice that have autism spectrum disorder. Autism spectrum disorder is characterized by lack of empathy, lack of sociality, these kind of things. People with autism generally can't relate to people without autism as easily. They lack the ability to sort of pick up on these social cues. And so the idea is that like empathy is one of these things. And so again, you can get model systems with mice that have been genetically modified so that they display these autism-like behaviors. And if you give them MDMA, they're more social than they otherwise would be. And so using this same model, they looked at whether the effects of the social transfer, of the empathy increase, would again occur. And it did. The MDMA, in these autism-like mice, increased that social transfer, increased that empathy. So again, another really interesting finding and another brick in the wall, let's say, of MDMA is enhancing empathy. They also did some experiments where rather than MDMA, you just increase the serotonin, the specific serotonin neurotransmitter that's being activated, and that also appeared to do this. So it's really narrowing in on what we call the mechanism of this action of how MDMA enhances empathy. And it all tells this really nice story about, yes, MDMA might be this empathy enhancing thing that we think it is. And once you have more evidence in that area, you can start to then extrapolate on the theories for humans, what might be good uses for this. If we think that, it is this, increase in empathy that's going on, how might we be better able to use this, to tailor this towards therapy and other sort of therapeutic outcomes. One really, really interesting thing that stood out to me, and the authors of the experiments of the scientific paper have no explanation for, is the effects were only seen in male mice. So if you give female mice MDMA, there's not this same increase in the empathy-like behaviors, in the emotional transfer, which is really, really interesting. And they don't really have an idea why. Both males and females without MDMA show the same level of the transfer, of the social emotional transfer, but the effects of MDMA only occur really in the male mice. And there's some anecdotal evidence as well in humans that MDMA increases pro-social effects in men more than it does in women, whereas in women they tend to report more, let's say, hallucinatory or like visual, sensory kind of effects, and there's also more adverse effects in women. And it's not really clear why that would be. Pharmacologically, why would that happen? It's not like there's no real difference between men and women when it comes to how these drugs act on our system. But it's just a really neat finding and something that would be really cool to explore more. But yeah, turns out MDMA works best for increasing empathy in male mice and doesn't work in female mice. I think this is a really cool study because it shows how you have to blend, these sort of mechanistic studies, what is physically happening in the brain, with, this other side of the research, which is the therapy, which is, using these things that we don't completely understand how they work in the brain, what their effects are, what they're doing, to increase our benefits from therapy. And there's sort of this age-old conundrum in science where we talk about whether things are predictive. So if we do something, we're going to get the outcome that we want, or whether they're explanatory. We can explain why that is. And there's different experiments that are set up to sort of do the two the two things, the predictive side or the explanatory side. And there's always this debate or discussion about what is the true value of something. If you look at something from the medical side, being able to predict disease or being able to predict that this is going to help you feel better is very valuable. But without that understanding as to why, you might lose sight of other uses for that thing, or you might lose sight of potential harms and side effects. So you really need both happening at one time. And as I mentioned at the top, teasing out how therapy works, how these drugs, which are so subjective, they create very different experiences for each individual. We just talked about how men and women experience things very differently under these drugs. Teasing out all of these factors is very almost impossible, it seems, at this point. And I like to think of it more as it's not one or the other. It's not teasing them apart, really, more as just understanding how they're knotted together and how you can make the tightest knot, which, the metaphor being the tight knot being the best outcomes for therapy. So how does someone's background, how does someone's environment, how does someone's physiology, their genetics, like all of this stuff, coupled with a drug, coupled with talk therapy, coupled with a different kind of therapy, how are all of these things going to work together to, get the best outcome? Part of understanding that is going to be understanding how they work in the brain. So this is a nice step towards that. Really, really cool study. And it's going to be really, really interesting to see when MDMA does get approved, what types of experiments come next, and what types of conditions or scenarios doctors, psychiatrists are going to use MDMA, given the results of experiments like this, and many more to come. So, as we've said every time we talk about psychedelics on this show, there's so much that we still don't understand in this weird gray area of the mind and, neurotransmitters and emotions, which is what makes it super, super fascinating, but also makes it feel like every time we get a step forward, we have more questions and maybe even less understanding of what's actually going on. But really, really fascinating one to watch, and we'll continue to watch this one. Thank you for tuning in. Make sure to subscribe to the channel, of course, but also subscribe to the podcast if you want full-length episodes containing all the different stories that we talk about on a monthly basis.